Acne isn't just a teenage problem. People of all ages can get breakouts for many different reasons. So we went to the experts at Pariser Dermatology to find out more about how to prevent and treat it. Explain to me, what is acne?
Acne is very common today. I'm going to talk more about adult female acne, but acne affects a wide variety of people, young and old. We typically see it in adults as well as adolescents. Typically when the adolescents, they have acne, it can last throughout adulthood, or you can actually get acne later on in life, and that can be very frustrating, especially for adult females.
So there is a difference between teenage acne and adult acne.
You're exactly right. Teenage acne typically affects the face. It also affects the trunk, but when I see an adult female with acne, I typically see it along the jawline as well as around the mouth. And they also have some other signs. They may have excess facial hair growth, which we call hirsutism. They also may have irregular menstrual periods and may even have some thinning of their hair, which may indicate that they have a hormonal disorder.
All right, are there different treatment options for acne?
There certainly are. When we treat acne, we have a wide variety to pick from topical medications as well as oral antibiotics. I'm going to talk a little bit more about birth control and a medication that's pretty novel called spironolactone.
And we've heard that birth control can help with acne problems. Is that true?
It is exactly true, especially for adult females. The birth control can help regulate hormones, and it actually helps prevent the hormones from going to the actual site of acne treatment.
And are there other oral treatments as well?
You're exactly right. There is oral antibiotics. These oral antibiotics actually help with inflammation. We're not actually treating the bacteria itself. And then also with the medication called spironolactone, it actually helps prevent the hormone from attaching to the site of where the acne comes about.
Are there topical treatments as well that you would recommend or that you can prescribe?
There's lots of topical treatments. For adult female acne, the topicals aren't quite as effective as the oral medications, but some things like Axone or even topical antibiotics can be very helpful.
And why is it that topicals not necessarily as effective?
For adult female acne, there's a strong hormonal component, and the topical medications do not help with hormones.
Wow, and what are some of the things that women can look out for? Maybe they don't realize that it is adult acne they're dealing with.
So adult acne in women, they typically look that it's actually along their jawline and on their chin, or they're developing acne later on in life and they didn't have it before. So a lot of women, probably 20 women per week coming in for acne, then they feel like a teenager again, except they don't have the fun of the teenager.
And if they come in, they see you, and you start a treatment program, how long before they start to see improvements? How long does it take? It
may take a month, but sometimes it can take 4 to 6 months to see some improvement.
So what do you
it can be very
recommend?
disappointing. Some people want their acne, they've been struggling with it for years and they want it better tomorrow. But usually if we reassure them and we work through it, they can get better in 4 to 6 months. But they have to continue to take the medications to keep the acne away.
All right, some great information today. Thanks for doing this.
No problem.
About how to treat adult acne, call Pariser Dermatology specialists at 622-6315 or visit them online at pariserdermatology.info.